Good day, everyone. Today I am going to share to you COVID-19 vaccine, specifically AstraZeneca. We all know that the COVID-19 pandemic has caused significant morbidity and mortality rate all over the world, as well as social, educational, and economic disruptions. So there is an urgent need to develop an effective and safe vaccine to be available across the globe. As of March 1, 2021, WHO released an interim guidelines about AstraZeneca. So I'm speaking to you about AstraZeneca because this is also the available vaccine that we have here in Saudi Arabia, as well as I think in Philippines, sa aking bayan na Sinilangan, ay ganun din po, AstraZeneca din po ang meron kayo dyan. So I just want to give some little information about AstraZeneca to keep us parang kampante po tayo na magpa-vaccine. The efficacy of AstraZeneca is 63.09%. The trial participants is from United Kingdom, Brazil, and South Africa. The vaccine will be given in 2 doses with an interval of 8 to 12 weeks as WHO recommended. The recommended age for AstraZeneca to be vaccinated is from 18 years old and older. According to WHO prioritization roadmap, the first priority are the healthcare workers. These are the nurses, the doctors. And the second priority are the older people with or without comorbidities. So sila po yung second priority. How this vaccine to be administered? As sinabi ko, as I said, it will be administered in 2 doses with 8 to 12 weeks intervals. Saan po ito ini-inject? Where this will be administered or will be injected? It will be injected in the intramuscular deltoid muscle. Dito po sa ating braso yan ibinibigay. There are some instances that if the second dose of the vaccine is advertently administered less than 4 weeks after the first dose, the dose does not need to be repeated. So, for example, supposed to be magre-receive po kayo ng second dose nyo ng after 8 weeks o 12 weeks, inaibigay na po less than 4 weeks pa lang. Hindi na po natin kailangan i-repeat ang second dose natin. Na sasabihin natin na, nako 4 weeks pa lang pala, less than pa lang 4 weeks, nagkamali ako, dapat pala 8 to 12 weeks pa. So, iulitin ko na lang uli yan after 8 weeks and after 12 weeks. Hindi na po kailangan nating ulitin yon. It considered completed na po kayo. Na-complete nyo na po yung second dose nyo. The other way around, if the administration of the second dose is inadvertently delayed beyond 12 weeks, it should be given at the earliest possible opportunity. So, sa kabila naman, sa kabilang side naman, for example ay na-delay kayo, should be given at 8 to 12 weeks, tapos na-delay kayo. For example, yung pang 12 weeks nyo ay kahapon, tapos ngayon nyo lang naalala na kailangan nyo pala mag-receive ng second dose nyo. Kailangan po mag-receive kayo immediately. For example, naalala nyo ngayon, o bukas magre-receive na ako ng second dose, wag na po nating hayaan o hintayin pang magiging 13 weeks na po ang delay ninyo. Okay? So, kailangan pong ma-receive ka agad. So, it is recommended that all vaccinated individuals receive 2 doses. Kailangan po talaga lahat tayo makareceive ng 2 doses. Hindi po natin, it is not good to say that I will receive only first dose and it's enough for me. Hindi po yun ang recommendation. Ang recommendation po ng WHO, you have to receive the second 2 doses of the AstraZeneca vaccine. So, for example, may mga tanong po tayo. May mga tanong po. For example po ay, ako po ay naka-receive ng first dose ng Pfizer. Pwede po ba ang second dose ko ay AstraZeneca? Hindi po pwede. Kailangan po isang brand lang po ng vaccine ang kailangang ma-receive natin ng 2 dose. For example, if you receive the Pfizer BioNTech first dose, you have to complete the Pfizer BioNTech second dose. It should not be Pfizer for first dose and AstraZeneca for second dose. This is not recommended. This is wrong thinking. Hindi po yan acceptable kasi kailangan po isang brand lang po ang gagamitin natin. Okay? So, take note po tayo dyan. For example po, may mga tanong. There are some questions. If I have a COVID-19, nagkaroon po ako ng COVID-19 before, no? Maybe before 3 weeks or 3 months or 2 months, I have a positive PCR for COVID-19. Can I avail the COVID-19 vaccine? As of that moment, you have to wait for 6 weeks. Okay? 6 months. Kailangan pa po nating maghintay ng 6 na buwan bago po tayo maka-avail ng vaccine na yan kung nagka-COVID po tayo the previous months or the previous 2 months. Magbilang po tayo ng 6 months bago po tayo maka-avail ng vaccine ng COVID-19. Yan po ang recommended ng WHO, the interim guidelines as of March 1, 2021. So, mayroon pong sinasabi dito. Mayroon po there are some questions. What if I receive an influenza vaccine today? Can I take the COVID-19 vaccine on the second day following the COVID-19, the influenza vaccine? No. If you are receiving some vaccination aside from COVID-19, you have to wait 14 days before you can avail the COVID-19 vaccine. Kailangan po nating hintayin ang 14 na araw bago po tayo makapag-avail ng COVID-19 vaccine after our previous vaccination. Some of us will receive influenza vaccine, hepatitis B vaccine, meningococcal vaccine, pneumococcal vaccine. So, lahat pong yan, pag naka-receive kayo, you have to wait 14 days pa po bago po kayo magpa-vaccine ng COVID-19 vaccine AstraZeneca. Yan po ang interim guidelines ng AstraZeneca. So, is there any allergic reaction? This is the most important kasi marami pong nagtatanong, marami daw pong nag-collapse, marami daw pong namatay dahil nagkaroon ng mga allergic reaction. Actually, during the clinical trial of AstraZeneca, there is no record that there was a severe allergic reaction to the participants na vinaksin nila, nag-participate sa clinical trial. But we cannot say that some individual have no allergic reaction. There are some individual have allergic reaction. That is why AstraZeneca components, meron pong naka-components doon sa AstraZeneca that you must know that if you are allergic of this component, you should not take the vaccine. In general, if you have any allergy to any medications, you should declare it to your healthcare worker before receiving the vaccine so they can advise you if you are going to take the vaccine or no. Kaya po, every individual who will avail for the vaccine must be assessed first properly by the healthcare worker, yung mga doctors, yung mga nurses. They will be interviewed and they will be assessed clinically if there will be any allergic reaction for any medication, so they will not be given for the COVID-19 vaccine because this is contraindicated. For us also individual, we should declare honestly kung anong pong meron tayo so that you will be managed properly. Okay? So there are some cases po if you receive the vaccine, for example, if you receive the vaccine today, you are not allowed to go home directly or immediately after you receive the vaccine. You have to stay in the vaccination center for 15 minutes for observation for any allergic reaction of the vaccine. So after you receive the vaccine, you will be observed for 15 minutes. Kaya tayo pong nagpapabakuna sa COVID-19 vaccine, tayo po huwag magmamadali. Tayo po ay maghintay muna ng 15 minutos doon sa vaccination center at oobserbahan po tayo kung mayroon po mga reaction ang ating katawan sa vaccine. Hindi po maganda na pagkatapos po ng vaccine ay aalis na lang po tayo kaagad. So we should stay first in the vaccination center waiting for any reactions, and we must be so that it will you must be managed properly or medically, okay? So if you have some there are some questions. If I have an illness, for example, today I want to take my COVID-19 vaccine but I am febrile, I am feverish, my temperature is 38.5, you have to postpone the COVID-19 vaccine. You are not allowed to avail the COVID-19 vaccine unless your fever will be resolved, no? Hindi po pwedeng magpa-vaccine kung mayroong lagnat na 38.5. Kailangan po muna nating gamutin ang lagnat na yan, matanggal ang lagnat na yan bago tayo magpabakuna. Okay, if only you have a mild infection, like for example, you have allergic rhinitis, meron lang po, you have a cold, you have a low-grade fever, maybe 37.2, there is no need to delay the vaccine. You can avail the vaccine immediately. Kasi wala naman yon, mga mild infection lang naman yon. Okay? If you are a pregnant woman, can I take the vaccine? If you are in the high-risk individual, like for example, you are a healthcare worker and you are pregnant, you can avail the vaccine. You have to avail the vaccine. But first, you have to consult your OB/GYN doctor if they will advise you for the vaccine. But there is no record that there is a placenta or there is a placental barrier that will affect to the baby during the vaccination. So there is no recommendation for pregnancy test prior to AstraZeneca COVID-19 vaccine. So you can avail this one. If you are also a lactating mother, like for example, nagpapadidi po kayo, you can still avail the vaccine, especially if you are a healthcare worker. But if you are not a healthcare worker, you are only in the house, you can avail later maybe. But if you are a healthcare worker which is high risk to acquire the COVID-19 virus infection, it's better for you to avail the COVID-19 vaccine. It is there is no record that during breastfeeding it can affect the baby. Wala pong record na ganon. And WHO did not recommend to delay breastfeeding after COVID-19 vaccine. Okay? So may mga question po na pag ako po ba ay magkaroon po ng first dose, if I receive the first dose, is there any possibility that still I can acquire the COVID-19 infection or virus? Yes. If you receive only the first dose and still you will be receiving the second dose after 8 to 12 weeks, during those times, before 8 to 12 weeks, you are still a high risk of having an infection of COVID-19 virus. You are still at the high risk. But after you receive the second dose, and you will wait for 14 days to another 14 days, you will be protected. This is the time for your immune system to develop and to protect you from COVID-19 virus. So, if you receive only the first dose, there is still a possibility that you can acquire the COVID-19 virus. If you completed the second dose and after 14 days, your immune system will respond to the vaccination, it means that you will be protected. It depends from individual immune system also. But as long as you receive the second dose, it means that you will be protected from the COVID-19 virus. So, I hope that I already give you some information. The efficacy is 63.09%, will be given in 2 doses with an interval of 8 to 12 weeks. And it must be given in the intramuscular. After the vaccination, you should stay for 15 minutes for observation for any signs and symptoms of anaphylactic or allergic reaction. And COVID-19 AstraZeneca can be given in 18 years old and above. So there is no record for delaying pregnancy if you receive the vaccine. There is no record of discontinuing breastfeeding. If you receive the vaccine, you can avail. You can still breastfeed your baby even if you receive the AstraZeneca vaccine. So if you have a COVID-19 before, you will wait for 6 months before receiving the AstraZeneca COVID-19 vaccine. If you delayed for 12 weeks for the second dose, it must be given immediately after 1 day of delay. Okay, so if you are also ahead for less than 4 weeks, you have received your second dose, there is no need to repeat the second dose. Okay, so I hope it is clear for us that AstraZeneca is I think is a vector viral vaccine. So this is from University of Oxford. So I hope that I have given some information regarding this vaccine. So I encourage everyone, take your shot, be vaccinated to protect yourself, protect your family, and even the community. Let's fight COVID-19 virus for our economy and for our to protect our constituents. Okay, so I hope everyone will be encouraged to be vaccinated. Thanks everyone. Thank you.